It's a choice that you make. You go to the party. Go to the party and enjoy the party. Like, don't go to a party and have a bad party because you're worrying about eating the pizza. Go to the party knowing that you're making those choices and that all day you reduced your calorie intake in preparation for the party. And the next day, having had the party, you're going to go on a really long walk, or you're going to go and do the good things so that you can go, wow, I had a great party. And then I had a beautiful next day because I went to the gym and I did the things that I needed to do. And I kept busy and I had a really good time. So there's a lot to do with communication and how we communicate with our patients and how we get them on board. Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists, and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Hello, everyone, and welcome to Mentoring with Geraldine and the Bite Size Podcast. And another exciting episode because I have the amazing and wonderful Andrew Whitfield-Cook here again. So he's been on the show before. He's been on the show twice before, in fact, once in January, once in February. And now here we are in March. And I've managed to get him back again. I'm very, very lucky indeed. And today we're going to be talking about communication and how we communicate with our clients. Because Andrew, as an ex-nurse and the practitioner and a rep and a podcast host, is, of course, all about communication. He's all about making sure that when we talk to our clients and our customers, whoever it might be, they need to know about, or they need to do things for themselves. They're not doing it for us, not doing it for anyone else. So, Andrew, thank you so much for coming on the show and talking with us about communication with our clients.
Yeah, well, it's a big issue, isn't it? And I bring it back to patient advocacy. In my role, in my previous role as a registered nurse, I still maintain my registration, but it's really only for education purposes. There's no way I'd put myself in front of a patient now in a hospital setting. I wouldn't know what to do. But to me, it's all about advocacy, and you have to instigate a contract of change for the patient. Yep. They've got to want that change. And oftentimes people, come to see you with, what will they do? What can they give me? But they don't really understand that the only way that they're going to change the outcome is by changing their foundations, right back to their foundations in some instances of what they've been doing previously.
Absolutely. Absolutely. And getting them, because to change a habit takes a year. To change a habit is a really long time. It's not something that happens overnight. I mean, when we talk to our clients, time framing for them is super important. So when you have a women's health, you're talking about periods with them, we need to say to them, you need 3 amazing periods. You need 3 periods the way you want them to have before we can start slowing down treatment. Well, that's what I say anyway. But then I also caveat with that, but also we have to have a good month before that 3 months to know it's a good month.
Yeah.
And then you're wanting a month post that to know that it really has worked, because the body takes 3 months to learn a new behavior. So our body takes 3 months to unlearn pain, discomfort, whatever it is that's going with your bad period, or to organize dates for your period if it needs to be longer. But with the mind and habits, we can give up sugar, but it takes us a long time to deny ourselves, and it's not even denying yourself, to realize you don't need the cake. You've given up sugar, and for a lot, it's like giving up cigarettes, giving up anything, giving up alcohol. There's a long period of, I really want it, but I can't have it. No, I will go and, jump on a trampoline. I will go and drink water. I will go and do something else.
Yeah.
And then there comes a point where it's actually, I don't care and I don't need that anymore. And we have to reach that point. And then we have to stay with that point and go beyond it.
But even before that, you've got to get the patient into a frame of mind where they actually want to embrace that change.
Yeah.
Because without that willingness to even embark on a change, they have to want something greater than what they've previously been doing. So there's got to be this, a carrot, dangling a carrot, basically, saying to them, what is it? It's really sort of feeding the dream of what life can be like in the future.
Absolutely.
And I know this is a very poor analogy, right? But it's kind of like this, sort of. And that is Lise Altschuler, a woman who I just love dearly. She's got one of the most positive minds who espouses gratefulness and gratitude in her patients. And she'd say, when patients say, I'm scared of dying, she would counter that and flip it by saying, well, isn't that because you love life so much? Yeah. So how about we work on loving life and what you can gain from the future? Yeah. And that's how she changes that mindset from a negative, scared, confrontational, barrier, all of these stop words to, oh, what if? Yeah. Oh, a maybe. Oh, I wish I'd love that. So she paints the future into their minds of what that can potentially be.
Future-focused and solution-focused interviewing is, it's great, and it is the only way to do it. It's something you have to learn to do. It isn't something that we're taught. In college, your appointment has to be an hour and a half, because there's the 40 minutes with the client, then they go away and, they might do a radiology or something like that, in which time you get to speak to your lecturer, you get to talk to your P2s, you get to go through the case, and then the lecturer comes in and talks to you, and then you can call the patient back and say, this is what we're going to do. And in the real world, nobody really has an hour and a half these days, and they're not your friend or your friend's friend who's come to see you, because that's often what happens in college. These aren't people who've made a conscious decision to pay you a quantity of money for you to set them on the right path. And they've got skin in the game because they've given you proper money to do these things. And you don't know in college whether or not your client's gone and done things, because you may or may not get to see them again, because you only have 13 weeks in that semester. So if they come back, you'll find out if they've done it. Whereas when we're out in practice and we have these people and we want them to come back, so there's some financial ways of getting them to come back. You can sell packages so that they will come back because they've got another appointment lined up already. They've paid for it. So it's a great way of doing it. But when we converse with them, we have to get them to concept their own will to change.
Yeah, absolutely.
We have to change that mindset. We have to really think about, how can I get this person on board for themselves? How are they going to, and this is where this motivational interviewing, the miracle question, this is where this solution focused motivational interviewing and saying things, I feel like I'm going to die. What about life? Reverse it. Find out what their values are. Find out what's going on in their mindset. It's huge. It's absolutely huge. I actually love that analogy with just swap it over.
So there's also another line of questioning about asking the patient what their expectations of treatment are. And then you can gauge what is a real expectation versus a miraculous expectation. For instance, I can clearly remember this guy coming in asking me if saw palmetto would be 100% effective in preventing prostate cancer. And I said, no, Magic Shop is down the road. Yeah. I say, the best medicine in the world will not give you 100% effectiveness. So we've always got to gauge things by how reasonable is that expectation of success in that person as opposed to a population. Yep. And then you can sort of tie that into the treatment expectations per population sort of thing. Yeah. But I'm always reminded by a way which Dr. Andrew Heyman always gauges his patient's willingness to change. Yeah. He always says, how likely are you to adhere to this.
Yeah.
How likely are you to take these supplements 4 times a day? How likely are you to and so he'd say, give me a 1 to 5 gauge.
Yeah.
On a scale of 1 to 5, how likely are you to walk half an hour for every day?
Yeah.
And then he can gauge their response. And he said a lot of his patients got really shitty.
Yeah.
And he said, he started to warn them, and he said, oh, I'm going to piss you off because I will ask this time and time again, because I need to know how your willingness to change is moving throughout our therapy together, throughout our time together.
Yeah.
And it was a real interesting thing how, you know, like you get your type A personalities that just want to be told what to do and they're on their way. And then you get people that are just quite scared and apprehensive of change, of, you know, they don't really know it or what it's going to entail. They don't know you. They don't know necessarily how much to trust you.
Absolutely.
And so he would ask them these gauging questions to sort of try and get their response.
It's a great one, because how likely am I to take a tablet? Well, actually, for me personally, I'm very unlikely to take a tablet. So everyone who's watched me or followed me knows that I have my mud drink every day, because I can put every single thing in there. Sometimes it's got herbs in there. If it's a herbal, I can down it. It's a liquid. I mean, I can swallow tablets. I don't have an issue swallowing them. I just have an issue remembering to swallow them. And there might be something innately in me that says, you know, what is that? Are you going to rattle if you take that? What is that? And so we have to ask our clients, you know, what is the best form for you to take? Because some people, I actually don't want a powder, you know, whereas I've kind of got used to even some flavors of the powders I cannot take. So I tend to mix them all together and put them in a lot of water to spread out all that sweetness. But if we ask them, what form do you like? You know, if they say, oh, I won't take herbs. You know, there are people who say, I just won't take herbs. I'm like, okay, that's fine. But it will be around 3 to 4 different bottles of tablets to cover the one herbal tincture. Absolutely. That I'd expect you to take around 3 or 4 mils of 3 times a day initially. And then we could actually go maybe 5 mils twice a day if you prefer. So, you know, up to you. I don't mind. We can do either way. And the other thing I always say to them is, this isn't a dictatorship. You can choose what you want to take and what you want to do. I just need to know, so that I can tailor it to suit your lifestyle. Is there something else?
Yeah, and you can gauge their or you can change their expectation of results. Because, like, for instance, if somebody's only willing to take, you know, one supplement, you can say, okay, are you expecting this to be the magic supplement? So maybe their expectations of outcome have to be tempered somewhat. Or indeed, you might have to say, you might have that horrible decision to make and just say, look, I'm really sorry, I can't help you.
Yeah.
Because you're not ready to change. You're not willing to do the things that will change you from the track that you're on.
Yeah.
But what I would suggest is maybe I can refer you onto a more appropriate practitioner. Yeah. You know, and you know, in some cases that may be they're not going to take natural medicine and they need a drug.
Yeah.
That's it. And the outcome of that therapy will be what that drug will give them. So, for instance, if they're only going to take a certain anti-diabetic medication, you know, there are risks inherent with some of these medications. So they might give you a better quality of life in the meantime, but they actually might shorten your life, or they actually might do something else to you in the long run.
Absolutely.
That's their choice.
Yeah. Whenever I'm prescribing, I'm always prescribing diet, because diet is a prescription. You know, the lifestyle changes, habit changes are part of the prescription.
Yeah.
But we have to remember, using the word prescription makes it, although we're using it in our head as this is the prescription and this is what I need you to do, they may take that on as a definitive, I have to do this. So when we ask them, you know, what exercise do you do? And they say, oh yeah, I go to the gym. I'm never going to get anyone to do F45. I'll just put that out there first. But if I were an F45 advocate, I might turn around and go, well, I'd like you to start doing F45. Whereas in actual fact, they're going to the gym to have a coffee. Because, I mean, we've got a gym by us. It's absolutely beautiful. It's got a swimming pool, spa pool, beautiful cafe. There's a big fire pit in the middle of the cafe, all the rest of it. So, and there were definitely ladies there who went for a couple of whacks of tennis and then for coffee.
And to say they've been to the gym.
And then they've been to the gym. So, what is the expectation? I go to the gym, right? What is it you do at the gym? What do you enjoy at the gym? What is your best part of going to the gym? Are there any negatives about going to the gym? What's holding you back from going? So we can find out and we can tailor to what they need. I mean, that is the individual prescription, and that's what we do. We're so individualized for everyone. But I will always send people away. If I think someone's not on for it, like I don't think that they're going to they haven't got skin in the game. Maybe somebody else booked the appointment and I didn't realize, because I will not accept people who someone else books the appointment. But every so often one will slip through the net where the wife books the husband in or whatever. And they've got no skin in the game. And so literally all I prescribe them at that first appointment is diet change and exercise. Because if you can't do, and I do it with them, what can you do? How likely are you to take this? How can you implement this? Do you think you'll be able to implement this? What would you do and how will you do it to implement that? What times would you implement that? So I've gone through and I've double checked with them. And then at the follow-up, they will cancel because they don't want to eat pepitas for the zinc. They don't want to do the things. They do want to do them.
Yeah.
Somewhere inside them, they want to do them. They're just not ready yet.
Yeah. Yeah. Well, that's true. And there's a very good point there about the yet, because I think particularly with weight loss, and there was a picture forming in my brain when you were talking about the gym. So to say the word yet, especially with things like weight management, there is a weight loss cycle where people, poke at it with a stick and then they retract and then they don't do anything. Then they might investigate ways again, and they might take it for a little bit and then they'll fall off the wagon, and then they might make a concerted effort and it sort of goes round. And then they might, lose a lot of weight, reach a plateau, get all dismayed about their results, and then they might fall off the wagon, and then they might restart that cycle. So there's a whole weight loss cycle. And the best way to prevent people from returning to your clinic is to judge them.
Yes.
So you have to say, when you fall off the wagon, because it will happen, don't worry about it. Yeah. Just know that I'm here, and we can just regain that. We can get back on the wagon, get back on the wheel when you're ready. And if you're ready, it's okay.
Yeah.
And I was reminded when you were talking about the gym, I remember when, this is obviously years ago now, when I was going to the gym regularly, and there was a rather overweight young woman, and she was there with her parents. She was very disinterested and, typical teenager sort of attitude. Forgive that generalization. My apologies to many of the teenagers out there that are otherwise engaged. But she seemed really disinterested and negative about the gym instructor showing them how to do the various exercises. And yet through subsequent visits, it was this teenager that was actually taking the lead and the parents that were dropping off.
Yeah.
So she actually had found her reason for change.
Yeah.
But can I ask you, Geraldine, how do you get patients to enter into a contract to say, I'm going to do this for you if you'll do that for me?
Well, goal setting is huge. So if we've got the goal setting, because most people, in my intake form, so I have your basic intake form, if you suffered from epilepsy, how old are you, how many kids have you had, all of those things, the basic intake form. But at the bottom of it, I used to ask I think it's still there, what questions do you have for me, right? So I've set my expectations already. And what are your goals for seeing me? Now, the goals for seeing you are never something like, I want to cure my PCOS. They'd never say that. They actually have already said they have PCOS, but what they say at the bottom is, I want to get rid of my acne.
Yeah.
Okay. But then the third one, because I asked for 3 goals, more often than not, the first 2 are symptom related. And the last one is something really nebulous, be healthy. Okay. So when we've got a longer term one like acne or weight loss, because they're longer term, we need to make sure in that first appointment that they understand that this is a long-term commitment. And so I develop those timeframes with them. Yeah. So I'll say in the first appointment, or even before I see them, if they ring me and want a discovery call first, I'll say, I need to see you at least twice, if not 3 times fortnightly, and then we'll be able to spread it out beyond there. But it's going to take us time, because it's taken you, however long it's taken you, to get to where you are now. You've had, acne and PCOS and all of these things for 10 years. So it's going to take us time to deal with this, and we're going to have changes, and we're going to need to assess those changes on an ongoing basis. So they're already prepped that they're going to have to come and see me on a regular basis. And then when I'm in the appointment, I'm always saying things like, when I see you next, at our next appointment, we will. So I'm prepping them. So I've got their goals, and I've sat there with their goals. I've developed their goals with them, which are specific. So we've used the goal setting standard, they're specific, attainable, all of those things. So instead of saying I want to lose weight, it's I want to lose 40 kilos before December at my daughter's wedding. Okay, so we have our goal. We have a date. But at the end of that, so I will write out that goal for when it is. And then I will say, using, with the support of Geraldine and her programs. So they have a goal. If without a goal, we really don't change anything. We really don't achieve anything.
That's exactly right.
Sometimes teasing out that goal can be hard.
Yeah.
Sometimes there is no wedding or something to fit into a particular dress for. But there are goals, other goals that we can search for. And those goals are, well, what do you enjoy in life? Before you got to this weight, what did you enjoy the most? Oh, I really enjoyed going to the basketball game, but now I feel really conscious sitting in the stands because I'm so big and everybody else is slim and fit and happy. There's our goal. When's the next basketball season? We've found a goal by talking to them and finding out what they like. So it's always that positive mindset thing. Find the good stuff and use the good stuff.
Yeah, gravitate to what you want, not what you don't want.
That's
don't
right.
try and run away from what you don't want. Try and run towards what you want.
Perfect. Exactly. Yeah. Absolutely. We're going for that positive mindset. I used to really like going to the beach, but I don't go now because I look terrible in a bikini. Well, love, I look terrible in a bikini too, and I'm never going to be able to get in a bikini. But in actual fact, that's body image and self. And I'll wear a bikini because I want the sun on my tummy as well. And what about we work towards wearing that bikini with a wrap to start with?
That's what I wear. Oh, hang on.
Or just go on holiday to Europe. Just go to a nude beach in Europe. Just go anywhere. Go to Ibiza, anywhere in Spain.
Nobody knows.
Go to the beach, and you'll suddenly understand about body positivity. And you will learn very quickly that it's actually okay to be who you are and how you are.
Yeah.
But you do want to lose weight for your health. But we find a reason. We have to have that goal. And once we have that goal, and then we've explained to them how we're going to see them, when we're going to see them, that is what is going to help us for them to attain the goal, for them to be on board. Because they have to be on board. Without them being on board, forget it. There's no chance of doing anything.
There was something else coming to mind, and that was, what about what about the therapeutic action of not taking supplements? For instance, how many times have we heard, let's say, a migraineur or somebody who suffers headaches, right? So they suffer from headaches. You put them on to, let's say, Feverfew, CoQ10. Let's be really simple.
Yep.
And over a period of time, they say that's not working. And then two things. One, you can refer to your notes and say, well, hang on, how many headaches are you getting per day or per week? And they'll give you a number. And you can say, well, hang on, at the very outset, you said that at that point you were experiencing 10 or 12.
Yep.
So we have actually decreased. But what I want to do is to stop your therapy.
Yeah.
And it's sometimes one of the most telling things about how effective a therapy is when they stop it and they go, holy crap. I'm getting back on that glucosamine, or I'm getting back on that, CoQ10 and feverfew. Headaches is one of the quickest ones. Magnesium, feverfew, and CoQ10.
Yeah.
It works so quickly with migraines and things like that. And that it's only when they stop that they realise how much benefit they were getting from the therapy.
Yeah.
The other part of that, of course, is that dietary, the insidious sneaking in of old habits from dietary incursions, like, for instance, biologically active amines.
Yeah.
And you can see them, it's okay, well, let's investigate this.
Yeah.
So there's certain ways in which you can keep people on track by actually withholding or withdrawing therapy at some point down the track.
Absolutely. The really good note keeping, of course, without withdrawing the therapy, if you don't want to, is going back to the beginning, going, well, when I first saw you, you were having 20 headaches a day. Yes. Now we're down to 3. Can you see the changes? Where are those changes in your life? Because we forget how unwell we were in the beginning. So there's a lot about communication that we don't learn. We're not taught. I don't know about you, but in nursing college, when I learned, one of my first lectures was how to get the doctor to write up something or do something for you that you needed. It was literally a lecture, right? The lecture also included how to get over a hangover the next morning because we were student nurses. But, but it was a very practical lecture. And knowing how to do these things. I mean, I did a coaching course years ago, not because I wanted to be a coach. Well, I sort of did. But at the same time, I was like, well, how come they're all getting these results they're claiming to get? I'm seeing people for 3 appointments. I am getting change. I'm totally getting change. But they're not coming back to see me. I'm not getting the lifestyle change that these people need. I'm getting them over the headaches. The headaches have gone. But I'm not getting the change in the lifestyle that I want to see. And so that's why I did a coaching course. And of course, it teaches you how to use language. But then, of course, I had yet another modality. Here I've got another modality again. Do I need yet another modality? No. What I need to learn is how to speak to people within my own modality of naturopathy and nutrition to get them on board in themselves, not to get them on board with me, but in themselves to do the work they have to do. I can hand them all the supplements in the world, but I can't get them to take them. I can't get them to change their diet. They have to come round to that. And that is, I have a coaching course to coach people so that they can learn these skills to get people to develop within themselves. Oh yeah, there's my goal. That's what I'm trying to achieve. And I'm doing that with Geraldine. And I'm going back. My Weight Loss Thursday was one of my most successful programs. I'm not doing it now. But that's times, time and all the rest of it. And I'm not seeing weight loss people at the moment. But Weight Loss Thursday, Weight Loss Thursday, I developed a program. I would see them once a month and for a weigh-in, but we'd be in contact every week. And these people, they plateaued. And then I would get the message once a week, oh, yeah, we went to a party last night, so I just stopped and now I'm eating again. And so then they had the support. But there I was, right there on the end of the text, was part of the program that and so they'd start again. And it's all about that communication and forms of communication and learning to communicate with them so that they are the ones who are doing what they need to do for them, because you can't do it for them.
Wouldn't it be great with regards to weight loss if we could change the mindset about, rather than, I've slipped off the wagon, I've failed, rather than saying that, wouldn't it be great if we could say, well, that's fantastic, because we know from experience that the more times you actually have at trying to lose weight, in the end, you're going to be successful. For instance, I gave up smoking around about 6 times before, at 11:58 on the 30th of September 1988, I gave up smoking for the last time because of goal setting. But I had to do that. Like at one time, I'd given up for 6 months. You would have thought I would have kicked the habit, but no. So I went back, and it was only at that stage, 1988, 11:58 at night, that I actually gave up for the last time. Goodness. But wouldn't it be great if we could change that negative feeling to I fail to, well, that's fantastic. It's like a Thomas Edison moment about, you've just discovered another way not to, how not to make a light globe.
Yeah.
we now know it's fine. You know what your triggers are for, falling off the wagon. You know that it might be parties, you know, that might be things. So next time, maybe, you could institute taking along some carrots or your own dip or something like that rather than a pizza, or maybe even preparing for, having a pizza by preloading with a fiber that binds to a lot of that fat. So that it's not so bad, in quotation marks. Now, it's still bad, but it's not so bad. It will slow down the absorption. Yeah. That sort of mentality.
Yeah. And I talk a lot about choices because it's a choice that you make. You go to the party and enjoy the party.
Yeah,
like, don't go to a party and have a bad party because you're worrying about eating the pizza. Go to the party knowing that you're making those choices and that all day you reduced your calorie intake in preparation for the party. And the next day, having had the party, you're going to go on a really long walk, or you're going to go and do the good things so that you can go, wow, I had a great party. And then I had a beautiful next day because I went to the gym and I did the things that I needed to do. And I kept busy and I had a really good time. So there's a lot to do with communication and how we communicate with our patients and how we get them on board.
There was another point. Well, firstly, sorry, to recap, I can't let this one go. I just, in psychiatric nursing, there's a thing called drug holidays. And it's got to do with, do you need as much of that medication which was holding you? Are you able to reduce or even stop that, let's say an antipsychotic medication or something like that? Or can we change you on to a less strong one, something like that? Yep. It is not take lots of drugs and go on a holiday. It is not that. but there is premise for trying to reduce the reliance on supplements once somebody reaches a goal. And maybe that can be part of their goal setting. Absolutely. Just so, won't it be great when we're able to get you off this stuff and get you onto a maintenance dose? Yeah. The other point I was going to make is about the type and amount of language, or the complexity of language that we use. For instance, we all go to seminars and we talk about, cytokine and T helper cells and CD4, CD8, and then we talk about the inflammasome and NF-kappa B and all this. The bricklayer doesn't care nor know about that sort of vernacular. Nor they don't want to know. They want to know, is what you're going to give me going to make me feel better? So we've got to take the complex language that we learned and make that into a very simple language that they can understand. Absolutely. Here's an example. I had a doctor who I was quite friendly with, and he said, I've got to get that's right. He said, I'm so thankful for this book that you had, a booklet, an explanatory patient booklet, because I can still remember me talking to my patients about leaky gut, about intestinal hyperpermeability. Yeah. And he, not on one occasion, had patients coming back complaining because they had left his office, gone back to explain to their family what the doctor had said was wrong with him. Yeah. And more than one patient had gone back and relayed to their significant other, the doctor said that I've got holes in my gut. Yes. So you see how the vernacular changes, because they're not used to zonulin and hyperpermeability and things like that. All they know is they've got holes in their gut. Yep. So it's not, what is it? Chinese whispers. Yeah. So you have to be very simple with the vernacular that you use. And it's actually a complaint I have with many orthodox medical practitioners these days, not relaying complex and sometimes worrying diagnoses or pathology to patients in a simple way that they can give their significant other. Yeah. How often have we seen people going home to their wife and saying, the doctor says, I've got lymphoma, which usually has a catastrophic outcome. Whereas in actual fact, it was malt lymphoma, which is treated by antibiotics very successfully. Yeah. Yeah. You know what I mean? Yeah. So we all have something to learn about
Yeah.
simplifying that vernacular and maybe giving handouts that the patient can refer to later.
And it doesn't matter how long you've been doing it. There's always something that comes up. I've been saying TGA to people forever. And then somebody finally said to me, what does that stand for? And I'm just like, oh no, how many people have I said this to? So on that note of TGA and me my clients not knowing what that was, remembering that we need to sometimes simplify what we say and double check that our clients understand what we say. So it's all about communication. There's just so much. I mean, I've got a course coming up on it, but there is so much to learn in the realm of communication. So I'd just like to thank you so much for coming in again. It's been absolutely brilliant having you, as always. So thank you for coming back to join us. And of course, listeners, we'd like that 5-star review if you wouldn't mind. Just pop that one in there if you've stayed all the way to the end. So thank you, Andrew, and thank you, listeners.
It's always a blast, Geraldine. Thanks so much for having me.
Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.